Here is the side of the debate arguing for privatized healthcare or the healthcare system that they use in the United States. Here I'm just role playing, and these points do not necessarily reflect those of the teacher that's participating in this. Alright, so there are two certainties in Canadian society: death and taxes. In reality, we are taxed to death. I, being a teacher in his 12th year of teaching, paid over $17,000 in income tax. Income tax was this year. Income tax was established to help pay for World War, but it's never been taken away. And now our income tax and our sales tax and our taxes on gas and our taxes on whatever are all spent towards healthcare. And as I've said in previous lessons, 44% of all social spending in Ontario goes to healthcare. So the government's regulation of healthcare adds much more interference and intervention into an already overtaxed and over-governed Canadian society. From high taxation to regulation of foods and schools, from environmental restrictions to the embarrassing long gun registry, our fundamental freedoms as individuals and the universal responsibility of personal accountability continues to be compromised. Our freedoms are being taken away. Public health care in Canada increases government intervention and will cost taxpayers more money in the endless sea of bureaucracy that already poisons our society. It is time for the Canadian healthcare system to become privatized because, frankly, our public system just isn't working. And we all have our horror stories, from long lines in the waiting room to not being seen right away in an emergency to relatives getting misproperly diagnosed. Our system isn't working. And at a personal level, why should I pay for someone who broke their ankle skateboarding? Why should I pay for someone's bacteria infection because they didn't wash their hands? Why should I pay for someone's shoulder surgery because they got a hockey injury? If we all took care of ourselves and paid from our own health care, society would be in a much better spot. The Fraser Institute, it's one of the leading research institutions that shape our public policy and political philosophy in Canada, conducted a study of 25 countries' healthcare systems of the OECD. That's the Organization for Economic Cooperation and Development. Here are some of the findings. Out of 25 countries, only Iceland spent more on healthcare than Canada, yet Canada ranks 17th out of 25 in life expectancy, 24th in infant mortality, and 17th in prenatal mortality. Canada ranks 18th, again out of 25, in terms of number of doctors per capita. Private doctors would pay them more, and we'd be able to keep our top doctors here. In terms of medical technology, we rank 19th, and 46% of visitors to the Canadian emergency rooms have to wait a minimum of 2 hours. Clearly, with these rankings, we can do much better. Canada spent an estimated $142 billion on healthcare in 2005. That's $4,411 per person, according to Health Canada. After taking inflation into account, this amounts to almost 3 times what was spent in 1975. There is no way that I've ever cost the government that much money in a year. I'd feel guilty if I did. Individuals should not have to pay for the misfortune of others. Should I have to pay for the health care of a smoker? For people who don't brush their teeth and get gingivitis? For parental genetic defects? For someone who is clowning around in class and falls out of their desk? Individual responsibility is key. That being said, I have enough capital which rewards me for the hard work I dedicate under the promises of capitalism. I should be able to jump the line and pay for the best health care available. Access to health care isn't a human right, but individual accountability and responsibility are values instilled in us by political philosophers such as Hobbes and Locke. Our socialist, tree-hugging, granola-munching, Berkeley wannabe, Birkenstock-wearing powers that be continue to put policies that inhibit our ability to be free and to choose. If this continues, the visions of Orwell's 1984 will come true, and we will flush what is left of our freedom-given society down the toilet. That, of course, if our flushes don't become regulated as well. Michael Moore suggests that 18,000 Americans die each year because of no health insurance. Well, as callous as that sounds, 18,000 people is a small percentage of the 300 million Americans that we have. And some people are saying they want to pray for health care. They want to get health care in the States. Well, it's easy. Go get a job and pay for your own health insurance. And here are just some conservative comics that might fit that opinion. And I remind you that this was just a role play, and the opinions expressed do not necessarily reflect those of the given teacher. Thank you for listening.